When someone has a tragic accident or gets to an age where they cannot live without assistance of a medical device like a wheelchair or walker, it's not the only thing they need to get along with life. They also need physical changes to their home, and we refer to those as home adaptations. Historically, field workers will support cases for Medicare members of their health plan. But these are manual processes, and they use them to track these modifications, like ramps going in or support bars in the bathroom. But these typical home modification support is very manual. It's disjointed and wrought with human errors. There's manual data entry errors. The typical process did not scale or allow for growth. There's poor visibility into open cases and missed compliance targets that lead to financial penalties. This results in poor member satisfaction due to no communication or missed due dates. With this home adaptation power app, customers can replace those manual systems with modern application for case managers and field inspectors. These include automated email communication between contractors for cases, bids, and project management. Updating a field service solution to a modern platform can significantly improve outcomes and patient and member satisfaction. Executives get better reporting and visibility into key metrics. This excites and empowers field and internal support workers. It limits human error and provides visibility to data, leading and helping prevent costly penalties. This boosts customer and health member satisfaction, and this is built on a scalable and customizable platform for growth. We hope you will consider partnering with us to help provide quick and efficient home adaptation processes for your internal workers and for our members and patients who have this medical need. Thanks for watching.